again. Welcome back to TeraRecon's Tales for the Taxi Line. My name is Renee Stacy. I'm the Director of Product Marketing here at TeraRecon. And I'm joined today by, once again, John Danahy, our Chief Revenue Officer at TeraRecon, as well as my friend and colleague, Amanda Burry. She is TeraRecon's Vice President of Strategic Alliances. Welcome to both of you. Happy day 2 of RSNA.
Hi, happy Monday.
Great to see you. So, hey, day 2, like I said, we're seeing a lot of traction in the TeraRecon exhibit, which certainly doesn't surprise me. There's a lot of really great content and interesting stories that are going on. As well, we woke up this morning to see a lot of really interesting industry announcements. One of them, of course, being TeraRecon's newest announcement about Change Healthcare and the re-energized relationship that we are currently working through and announcing today at RSNA. I really wanted to kind of start this interview off with yourself, Amanda. You and I spoke a couple of days ago about this Change Healthcare arrangement, and you used the word re-energized, which I really loved. And so tell me why you think this relationship with Change is different than most, and really what's the benefit to Change about this?
Yeah, thanks, Renee, and thanks for having me on this Tales from the Taxi Line. I have to admit, this would have been my first RSNA here in Chicago, and I'm Chicago-based, so I was excited to have everybody in my wonderful city. But here we are virtual, and I'm really excited. I joined TeraRecon about 3 months ago, and in doing that, I had a hard conversation with John where I said, is our partnership ecosystem something that really matters and we're digging into? Or are we just having a partner ecosystem just to have one? Are we just partnering from a marketing standpoint with people? And he said, we have to make these partnerships valuable and important to our end customers, both from a TeraRecon perspective and from a relationship aspect, like with Change Healthcare. So coming in and pulling up my sleeves and getting my hands dirty, we started working with Change Healthcare where it really mattered. And we started to look at where TeraRecon was going from an advanced visualization and an AI perspective, as well as where Change Healthcare was going from an enterprise approach. And that really helped us modernize and re-energize our partnership, where we now could take a really strong alliance together to go in and speak to our end customers with a value. And I think it's really important that our Titanium offering, which is our new subscription offering, really provides a value not only to the end customer, which is our hospitals, health systems, and clinics, but also helps with patient outcomes. And we have to remember that the patient is always at the center of many of these experiences. So I was very excited to work with the Change team to re-energize this relationship and take it to that modern selling approach where we are working on a selling motion together. We're going to the end customer with a story and with value and with a strategy that really matters. And so that's why I'm really excited about the announcement that we had earlier today. And I look forward to continuing that relationship with Change Healthcare ongoing.
Awesome. That's amazing, Amanda. And you mentioned the inclusion of TeraRecon's subscription offering, Titanium. Of course, Titanium was launched formally here at TeraRecon probably in the July-August timeframe, right, John?
Yeah.
We've had, it's been a very exciting few months in terms of rolling this out to our customer base. We're getting a lot of really positive feedback, a lot of really important traction. John, tell me a bit about how it's being received with the customers that you're speaking to and with your sales organization that you're leading.
Yeah, no, I appreciate it, Renee. And a quick shout out to Amanda and all the hard work she did with the team at Change Healthcare and our friend Aaron Green and Rob Darwin, who actually worked very closely with us on this announcement. So really appreciate all the team participation from the group at large. But you're right, Renee. I mean, this pivot and this move toward a subscription-based offering is really what this market was really looking for. Obviously, the challenges that we're seeing in our economy and I think at the broader market and healthcare providers and the challenges that they're having. This need for a lower cost of entry, a low friction point, but being able to build in obsolescence protection, being able to say, we're going to continue to provide ongoing clinical features and functions, not just necessarily just the updates that come with a software license, but you're going to get more and more from us. We're going to continue to drive and establish more and more value over the relationship with our customers and the term of these agreements. And so I think what you're seeing is just really the beginning of a lot of incredibly high-paced changes at TeraRecon that are going to make us a better company to work with. Both from a partner standpoint, but even our end user customers that we have in common with our valued partners is how can we make this a better overall user experience, clinical experience, and value to the point that Amanda was making. But do that in a way that actually drives accountability back to our organization, and again, gives that low cost of sort of entry, if you will, frictionless sort of entry point. So we're super excited. I mean, I think this notion that subscription is kind of the way that businesses want to operate these days. But again, it comes back to accountability to customers. And that's what I'm a firm believer in. If we're going to put the customer at the center of the universe and their patients as a result of the center of the universe, we have to hold ourselves accountable to continue to drive more and more value over these relationships. So I think you're going to see more of that.
I hope so. And I'm sure Amanda's going to be working really hard to make sure that we've got a lot of that. So that's excellent. Listen, thank you very much for joining us. Today, I know was a really busy day for both of you. It's probably going to continue for the rest of the week. Let's absolutely get together. I want to remind everyone who's watching this that Amanda Burry actually has a scheduled interview with Change Healthcare later on in the week. So watch for that information coming to you soon. And listen, guys, have a great evening and we'll talk again soon.
Thanks. Good seeing you both.
Renee.
All right.
Thanks, John.
Take care.
Bye.
Bye.